Welcome to Devils and Details. I am your host, Annie DeGraw. Today, we are talking about COVIDsim, a pandemic simulation out of our Ask a Biologist team. COVIDsim is a science-based simulation tool that was created to help visualize the way that preventative measures around COVID, the things we know, masking, social distancing, vaccinations, help in the fight against COVID-19, but in a game form. Joining us today to talk about that, we have Chuck Koselik. Chuck is the Executive Director of K-12 Outreach and advisor to the Provost on Academic Technology. Thank you for joining us, Chuck.
Thank you for having me.
So what is really interesting, and we're going to have this come up on the screen, this game allows you to learn all the things that we've learned over the last 12 months, but really put it into perspective about how it changes outcomes in a community. When a user lands on the COVIDsim page, walk me through what they're looking at and how they can start playing.
Well, what most people want to do is they'll want to hit that play button and jump right in. Once you get to the play button, it's easy because you're going to be designing your own city. You're going to decide how big that city is going to be. And the few more steps, you'll be deciding, are they going to have any safety measures or not? What kind? And once you've made those selections, you can pop into the simulation and have it run. You'll find out how successful you've been, how many people were infected, how many recovered, and unfortunately, in many cases, how many people died.
Having gone in and looked at it myself, there are so many different ways to get to the end. And I think that's really the goal, is how every single factor affects the end goal there.
Yes, absolutely. It's an infinite number of combinations you could probably come up with. But the end result is, of course, how do we minimize the number of people that are going to be infected, and certainly how many people are going to die? And this is a really interesting tool because it lets you see what works well, what doesn't work well. And more importantly, I think people have to start thinking about the fact that when they compare it to what's going on in their own town, their own city, they're going to find out that the model seems to be doing better than they are. And they have to ask themselves why. And the answer they're going to have to be, well, the answer they'll come up with is likely that, well, humans aren't doing a really good job of doing their part as far as masking and social distancing. What they also will realize, and you can see it through the simulations, is that vaccines are really, really good. It's based on real world data. It's based on actually data from Johns Hopkins. And the mathematical model was actually done by Abba Gamal, who's a professor in the School of Mathematical and Statistical Sciences. It rolls right off your tongue, right?
It truly does.
So, and I just have to make sure I give a really, upfront, let everyone know that we had some great advisors from the School of Life Sciences. We had some K-12 teachers involved, but the lion's share of the work was done by Carla Moeller and Sabine DeVish. Carla runs the Ask a Biologist, the day-to-day, and actually more than Ask a Biologist, we have more Askas out there. And Sabine DeVish is our, I'd have to say, amazing game developer.
I would say one of the most interesting things here is if we had had this conversation 12 months ago, none of the viewers would know any of the terminology we're talking about now. But of course, it's a part of our daily lives. Why is it so important when viewers are playing COVIDsim to really understand what each of these measures does in terms of lessening the virus's impact in our community?
Well, I think what it does is because as you play the simulation and you push a lever, pull a button, type of thing, you're going to put a mask on, you're not going to wear a mask. How many people are going to wear a mask? What it does is it allows you to see these what if scenarios. You don't have to know all the details. However, the details are always available in the simulation, so you can click and expand it. So it's just-in-time learning about these different areas. If you want to learn more about herd immunity, for example, it's right there. But the real gist of the game, and I don't even like to say game because this is a serious world we're in right now. So when I say that, I say it only in the sense that you can play different scenarios.
I actually think that the game terminology makes sense because one of the reasons that this was created was that you want to use it in classrooms. And how would that be used in classrooms?
Yeah, because you can run so many different simulations, you can set up different scenarios, whether it's a change in population, the number of people that are infected, the kinds of safety measures you're going to use. And so what the students can do is they can go through, run these simulations, document them. As a matter of fact, we created a data sheet that's available in COVIDsim that they can download, either a printable one or there's a Excel version and a Google Sheet version that they can track and then they can graph. And so you get to do a lot of comparisons. And like I said, it's the ultimate what if. What if we were really good at wearing masks? What if we were really good at social distancing? And that's one of the earliest feedbacks we got from people is they run the simulation and it doesn't match what they expect based on what they think is going on. And the reality is the model's really good at following rules. It does a great job. Humans don't. And so I say basically our masks and our social distancing are leaky, right? That we have a tendency to inadvertently or deliberately break the rules, which has serious consequences. Vaccines, on the other hand, are really great, right? Once you have a vaccine, and we have some really great vaccines, by the way. Not all vaccines in the past, the flu vaccine is sometimes 50% effective, right? We have some really great vaccines. And so the nice thing is once you're vaccinated and your immune system is trained, it doesn't matter whether you break your social bubble if you're doing it with other people that are vaccinated. It doesn't matter if you're wearing the mask correctly, per se. It will keep working. And so that's why COVIDsim becomes so important, is for people to understand that there are all these measures that are really important to use. We're really bad at using some of them, but the vaccine is the ultimate. And that's what we really want people to get the message on.
I love that. So the vaccine is the game piece that allows you to finally get to that winning deadline. Chuck, last question for you. You mentioned this earlier, Ask a Biologist website. There is lots of good COVID-19 information on that website. What else can users find there?
Yeah, we've got some great stories up there. We've got keys to the coronavirus was a great story. Vaccine science. A lot of people really don't understand how vaccines work, and we have, that's everything from do vaccines scare you to a world without vaccines. Lots of topics in there. We also have some videos coming out. They'll be coming out in the next few weeks. One's called COVID-19 and Your Body. The other one is Vaccines, Who, Why, and Should I? And the third
The
one
rhyming is intentional, I think, there.
And the third video will be about all the testing, how vaccines are tested. And that one doesn't have a title yet. So maybe you can come up with a great title for us.
I love that. I'll have to go through my rhyming book. So lots of great resources on the Ask a Biologist. Do check it out. Check out COVIDsim. It's such a neat, and there's a great video that walks you through exactly how to play it. So highly recommend. Chuck, thank you for joining us on Devils in the Details. To all of our viewers, stay safe and be safe.